All right, guys. Super excited to have Keith Levinson on the call. He's a physical therapist of 14 years. He did the upper extremity fellowship program at Ohio State. And importantly, he worked with the Cleveland Guardians at the AAA level, specializing in shoulder and elbow injuries, a rehab specialist. He deals with overhead athletes, of all sorts. And so this is, really important in the middle of this arm injury epidemic. And so, Keith, just introduce yourself and anything you'd like to talk about while we're dealing with this big arm injury epidemic and how we can avoid it.
Joe, thanks for having me on the page. I really appreciate it. Yeah, so my name is Keith, like Joe had mentioned. I'm a physical therapist for 14 years, and I had the privilege and the pleasure, great opportunity to work in professional baseball for a season. I did an upper extremity fellowship program through Ohio State's University, and I was able to work with the Cleveland Guardians for a season, predominantly at the AAA level. So I got some really valuable experience and knowledge working at the clinic in Ohio State with youth athletes around the Columbus, Ohio area. Some semi-pro guys, pro guys who come in the off season, coming into the Ohio State Clinic, and then obviously working at the ballpark each week with the pro guys at the MLB level. So a lot of valuable information, a lot of valuable experience that I gathered, and I'm still continuing that tradition right now. Still working with a lot of pro athletes and some youth athletes around the Long Island area where I live and reside, and helping out with our sports medicine program here. So thanks for having me aboard.
Absolutely. And I gotta say, man, I'm honored to have someone of your caliber, on the page and talking about this. This is something so important. I'm working with so many athletes and they are, so many guys, it's literally crazy, are coming to me and they have elbow issues, they have shoulder issues, and, they're trying to navigate the career of baseball. And obviously it's an overhead throwing, sport. And they want to have an incredible career. They want to have a long career. They want to get to the highest level they can. But the way baseball is right now, kind of the incentive structure, throwing max effort. We've seen an insane epidemic of injuries. Something like 34%, over a third of major league pitchers have had Tommy John surgery. It's been crazy. I live LA area, and so the Dodgers are my team, and it's like every single pitcher practically is coming down with some kind of elbow or shoulder injury. And so a lot of us are trying to figure out, okay, how do we solve this problem? And so that's what we're going to try to figure out. So kind of walk me through, for a young athlete, what are the risks of, pitching and what are some ways that we can think about it to try to avoid those injuries?
Yeah, before I get into that, I actually have some really interesting statistics here that I'm going to pull up. Um, the overuse epidemic, I think you hit the nail on the head here. I have some alarming statistics I actually want to share as well. 74% of overhead athletes, youth athletes aged 8 to 18 report arm pain when throwing. 45% of pitchers under the age of 12 have chronic elbow pain. 58% of pitchers at the high school level have chronic elbow pain, and 23% of pitchers report injury history from overuse. So there's definitely a big epidemic that we're experiencing right now that we're going through, and it's unfortunate. And the numbers are continuing to keep rising. The intake and history of people complaining about shoulder and elbow pain, and the amount of people athletes going on the DL and experiencing that time lost in baseball, having season-ending surgery. It's a major issue that we're experiencing right now, unfortunately.
Yeah, I mean that's absolutely insane. I mean that's even worse than I was thinking, honestly. And I'm getting, talking to people all the time. And it's something that, yeah, we've got to address it. We've got to honestly raise consciousness about it. I think that's, one of the biggest things we can do. And if we can raise consciousness, that'll help. And then we can try to figure out, exactly what's going on. And so, um, one of the things that I do is I'm trying to, help with clean mechanics, not pursuing velocity, especially at a young age. And that's why we, teach the knuckleball to less, it's not a max effort pitch. And so, in your opinion, having worked professionally with pitchers and just like really inside of what's happening, what is the leading cause of this epidemic that has just gone out of control, especially in the last, 5, 10 years?
Yeah, I mean, there's a lot of factors. There's tons of variables that kind of go into this, but the one thing that I can think of off the top of my head, and we were just talking about this, is specialization
Mhm.
of a specific sport. We're seeing more and more athletes kind of pick a sport early on in their career and trying to develop that niche, I guess, if you will, at a very young age. And I've seen too many issues at a young age, starting at like 8, 9, 10 years old, playing baseball and only baseball and throwing throughout the entire course of a season or a year. That's how these things start to kind of transcend, and you start to see like the unraveling of the body breaking down, and injuries starting to kind of compile and pile up. So I would say the main I wouldn't say the main, but one of the main issues that we're seeing is sports specialization at an extremely young age.
Sure, like with, I'm in baseball, and so you see basically at the age of like 7 or 8 or sometimes even younger, is people get caught up in like, Perfect Game, and there's other big baseball organizations where they're ranking 8-year-olds based on how hard they're throwing. And so from a young age, they feel like they've got to keep up with like the top kids in the country. And,
Hmm.
I've read that a lot of the injuries that happen when you're, in high school, college, or even pro can be traced back to, all of the wear and tear that you're having when you're younger, when you should be maybe playing another sport or maybe just working on your mechanics, and just kind of having a less strenuous workload. Could you speak to that? Like, I guess, like for a younger guy, like say before puberty, under 14, what would be like a way of kind of like approaching pitching to kind of avoid these injuries that are really like affecting guys?
Yeah, I mean, I have young kids who come into the office, and it's alarming when they tell me all I do is play baseball.
Yeah.
So I ask them, do you play any other sports? Do you play soccer? Do you play football? Are you on the swimming team? Um, do you ride BMX? I mean, you're out playing manhunt, and are you just being a kid? And then sometimes, most of the time, the answer I get is no, because these kids are at travel baseball, they're at school ball, they're playing summer ball, spring ball, winter ball, fall ball. They're playing all year round, and they're not really divulging and getting into other sorts of movement patterns and other sorts of sports, I guess, if you will, that kind of helps develop their neuromuscular system in a sense where they can learn how to be challenged in other ways where they're not going through the same repetitive motions over and over and over again.
Mhm.
So to kind of go back again to the specialization of sport, to me, I think that's one of the main issues that we're kind of experiencing at a younger youth age. At a younger youth age.
Yeah. At what age would you think it's like it makes sense to specialize?
That's a good question. I think it depends on the maturity level of the kid. I mean, all these kids are growing at different rates. I mean, I have kids in 12th grade who look like they're in eighth grade. I have kids in eighth grade who look like they're in college, right? So I guess it all depends on the kid. But I guess if I had to put like a specific number on it, I mean, maybe 17, 18 is probably when you can start specializing more in a sport. That's what I would do at least. I mean, you see a lot of multi-sport athletes in college, right? A lot of these guys who come out of college and make it to the MLB or NFL, they were multi-sport athletes in college. They
Mhm.
played a fall sport. Maybe they ran track. Maybe they did a winter sport, depending on like what their primary sport is. I know a lot of NFL guys run track in the spring, and
Mhm.
they're on NFL the college football team in the fall. So I guess it depends on the player, but if I had to pick a number, maybe 17, 18, you know.
Yeah, for sure. Yeah, no, I'm like, curious, like in your practice, your overhead athletes, like, give me an idea of like kind of the age, what kind of sports people are playing, and just kind of like the reason for the injuries that you're seeing.
There's layers to this stuff.
Mhm.
There's a lot of sub layers. It's almost like an onion. You got to kind of peel it away and get to the core, find out like where the main issue is. But sports specialization is one of them. Sports specialization. The other thing I see is you don't really see a lot of kids on good foundational, fundamental strength and conditioning programs. They just don't exist,
Mm.
which is kind of sad. I'm also seeing a lot of kids with poor body mechanics, poor pitching mechanics. They're not getting good instructional content from their pitching coaches, um, or their um, or their coaches in general who coach them for their teams, respectively, whether it's their travel team or like their high school school team. And then the one thing that's really missing, I see a lot of things missing when I ask players who come in to my office, have you been on, or have you ever been on, or are you on now currently a dedicated arm care program? And usually most of the time the answer I get is, what is that? I don't even know what that is, which is concerning.
Absolutely, yeah. So, I mean, that kind of begs a question, like, what would you say would be a good arm care program for a kid that's trying to get through this gauntlet of pitching without all the injuries?
Yeah, I mean, it's really something that's going to tackle the whole upper quarter, right? So we talk about the shoulder blade, the scapula, the glenohumeral joint where the rotator cuff lives around. And then if we're talking about preserving the UCL, the most important ligament in the elbow for a thrower is it's working on all those dynamic stabilizers that surround the elbow area. The flexor pronator group primarily. All those things go hand in hand and coincide with good mechanics, good strength and conditioning program, and being a multi-sport athlete.